Childhood obesity is a growing epidemic in the United States. I'm happy to welcome today Deborah Proctor. She's the president and CEO of St. Joseph Health System, a network of 14 hospitals headquartered right here in Orange County. Deborah, thanks so much for coming.
Thank you, Larry.
We've known each other for a number of years, and I've been involved with the health system for 30 years, and you've been involved with healthcare for as many years, I believe.
Yes.
And you were a bedside nurse.
I was.
And now you're the CEO of one of the most prestigious and most praised health systems in the United States. Can you tell us about what the health system is involved with?
Yes, the health system itself is made up, as you said, 14 hospitals. We also have medical groups that are affiliated with us. We have home health care agencies. We provide hospice service in a number of our organizations. And then we do a lot in community health and community work, community benefit to our neighborhoods that we're in.
So you've always been noted to give back to the community, and I now know that you're involved with a very fantastic program which I want to discuss in a second. Your new focus here is on childhood obesity. Can you explain to us what the definition is of obesity in a child, and how is it growing or is it decreasing? Can you explain that to us? Sure.
First of all, childhood obesity isn't defined by a specific, we use body mass index, which is your weight over your height of a child. And then we look at all of the children in the United States, and children who fall at the 95th percentile of that number are considered obese. So you're talking about at the highest end of it, and then 85% is overweight. So you're looking about 15% of the population to begin with.
And it seems like this is growing now, right?
Absolutely.
Not decreasing.
The numbers of children that are falling into the categories of being high on that marker of BMI, it has increased dramatically. And here in Orange County alone, the goal that's been set for the country is a 5% rate of a high BMI. We have in Orange County, 22% of children are considered obese, and another 12.5% are considered overweight.
Oh, that's astronomical. And so the program is designed, it's a multifaceted program, but is there any theory at this point why obesity in kids is accelerating?
Well, the most common theory that's put forward, of course, is the change in our diet and the change in exercise. People believe that there is some decreasing amount of activity on the part of children with all of the video games and the computer work and the time children spend sitting now versus the time they spend active. And in addition, it is our diet. Our Western diet is not a healthful diet. So those are the two most important components. We know that in the last 10 years alone, our caloric intake in children has gone up by 200 calories a day.
200 calories a day.
And it's from soft drinks, it's from fast food, it's from all those things that are easiest for families to consume and easily available.
And 3,500 calories extra calories is a pound, so it can add up very easily in a year.
Very easily.
Very easily. Now, tell us about your program. I know the health system has set aside a certain amount of money. I know you've given money back to the communities for many, many years. But tell us about this unique program and what you did and what it cost. And
let me back up a minute and say one of the things we stand for as a health system, people tend to think of us in terms of our hospitals, such as we have St. Jude's Hospital here in Fullerton and St. Joseph Hospital in Orange and Mission Hospital in Mission Viejo. But we consider ourselves a health system, not a hospital system. And so we're as responsible for health as we are for caring for those who don't have good health, for those who have illness. So we want a balance of both health and illness care, because obviously people are going to still get sick and we need to provide care. But we feel very strongly we have a community responsibility to be improving the health of our communities. So the first thing we did is we went out and measured in all of our communities for all different diseases and statistics and looked at, what are people consuming and things. And what was consistent across every community we serve was obesity. And obesity, as you know very well, is a precursor for heart disease, for diabetes, and for many other diseases. So that's what caused us to focus there. Our hospitals, we take 10% of everything we earn and we turn it back into work that we do in the community, and we give grants out into our community for work that's being done. We identified this program called PE for Me that Dr. Michael Weiss and the American Academy of Pediatrics had started. And it was a school-based program to increase the amount of physical education.
So PE stands for physical education.
Physical education for me. As you know, the state has cut budgets and schools have cut things like PE programs. So this was a program that Mike Weiss was bringing into the schools. But as a single individual trying to do this, he couldn't grow it fast enough. And so we provided a $3 million grant here in Orange County.
$3 million?
$3 million over 3 years here in Orange County to fund these programs in schools, as well as to fund a nutritional side of this. Mike's program was strictly based on physical education, and we expanded it to include wellness screening for the children and to focus on diet and nutrition.
Oh, so it's all encompassing.
It's all encompassing.
And the screening, you're screening for what kind of problems? Like?
Well, anytime a student signs up for PE for Me in their school, they are screened, and it's where we determine their BMI and you know where they fall in terms of weight. And I should say the program's not just for children who are overweight. This is a program that we talk about as a health program for all kids in the schools.
Yeah, that sounds
so
smart because
combination.
Yeah, so there's no stigma. I'm overweight. I'm going to an overweight program. I'm going to a health program.
Some of the early school-based programs did do that, and they put kids in these programs. This is a totally volunteer program. You have children of all sizes and physical capacity in them. They are screened then for hypertension. Believe it or not, the incidence of hypertension in children has increased dramatically. One of the interesting things we've found is there is a skin marking for diabetes. It's a discoloration of the skin. It's more common in African Americans and Hispanics, and it's an early indicator that this is a person who might have diabetes or other endocrine problems. So any children that we find that on, we put them immediately into a physician's care. The percentage of that used to be about 1% of children that pediatricians would see. In our program last year, we saw 17% of the children who joined our program had that marking.
Wow, that's amazing. So how many people have you screened so far?
Well, we're up to 3,000 children now. We have 100 schools that are participating, and we have a total of 3,000 children that are enrolled, and we will be growing that every year by hopefully about 100 schools a year.
And you're seeing results?
We are seeing results. Now, childhood obesity is not something we're going to see dramatic results for. We'll see it for many years, but what we targeted for a result was to stop the increase. So if we could just get the increase to decline and to keep the amount flat, that would be success. Actually, we've seen a decrease in the BMI in the children who are in the program, which was more than we expected to see.
So it's going to pay off.
It is going to pay off, and payoff is an interesting term because we're thinking about healthcare reform and the cost of healthcare. I just saw an article yesterday that said for diabetes alone and obesity alone, we spend $1,400 a year more in this country for obesity.
Well, we're just about out of time. I just have one last question. How do people find out about this? Is it on your website?
You can find a link on our website, or you can go to Healthy for Life online, healthyforlifeonline.org. And we have a set of recipes. We've created recipes that are healthy recipes that families are using. And these are free. You can just download them off that line.
Fantastic. It's very informative. Hopefully people will join, be interested, and you'll change the outcome of a lot of kids. You start now, prevent the terrible disease later on. Diabetes is a horrible disease, as you know.
Yes, it is.
You're going to be congratulated on your career and being the head of such a fantastic health system.
Thank you very much.
Thank you so much.